Hi, so I'm Joanne Goodall. I'll try and keep myself organized, so I have to stand here so I can see my PowerPoint because I could go on for 5 hours, and people know that about me. If anything, this is something that people might not be used to this language, and I can't say I do it with every visit, but a lot of people do this, and especially people have said, like, what do I do if I make a mistake? What if I misgender somebody? What if I say something wrong? How do I recover from that? There are a lot of people that say, you know what, and I did this in the beginning, and someone's in the room that knew me when I started out. I'm pretty new to this, but I've got lots of good mentors, I've got lots of good teachers, and I really care. And so please bear with me if I make a mistake, if I say the wrong thing, I really don't mean to. Please tell me because I don't want to offend you. And people hear that. They know that your heart's in the right place, and that's exactly what was said to me. You'll do just fine, you care. And so, now 6 years later, I've seen like over 200 people. I have a pretty big caseload at Adolescent Clinic. I'm the lead clinician for the gender team, as we call it. There's a few other providers, so I'll kind of give you that, and I have a little spot out there at a table. So the Adolescent Clinic is also called the Center for Adolescent and Young Adult Health. We're in Oakland. We're going to be moving down the street. We're behind, this is Pittsburgh directions, we're behind the old Arby's. Which is going to be torn down, so that'll be even more Pittsburgh directions. But we're going to move down the street sometime this summer because we've outgrown our clinic. There's myself and 2 physicians that do medical care in the clinic. We have social workers. We've had the whole Betty Hill, who was on the panel, came out about 6 years ago and did our training and went from like kind of soup to nuts on how you deal with issues and how are you friendly to the community. I hope to go over some of that stuff. That's kind of my job today. There's also Dr. Selma Witchell as an endocrinologist over at the hospital. So we see folks, we advise parents from anywhere from 2 to 3-year-old children, and we see clients up to age 26. We're connected to everybody, as I said, we can find in the community within, if somebody says, oh, I go to a therapist, oh, are they good? Do they want to be on my list? And I connect with them and try and get them on my big list that Dr. Wolf keeps he's over at Forbes on the edge of Murraysville. But we have a list of providers who have identified themselves as transgender, competent, and friendly. Not everybody's an expert, and not everybody's trained in a specific training, but they've educated themselves or gone to some trainings, and they're open to that. So anybody that kind of wants to be a part of that list, I have a family that comes from 4 hours away because there's no other services. I have people that come from Erie and New York State. Let me ask if I can send it out to this many people. I'll have to ask. But that's why I want a state list, and again, I don't know how to do internet stuff, but a whole state map with the little points would be ideal because then all of you, with all of your programs and anybody you find, you could say, hey, send your name to this list so you could be listed as well. So clients could pull it up at home, and you don't have to go through the Google search, or you do a Google search and it would show the whole state. And that would attract folks from Ohio, West Virginia, Maryland, New York. That's where we have people coming in from. So I wanted to mention all that. Just a couple other things that we have as people were talking about setting up support systems in their areas. When we started doing trans care and people heard about it, PFLAG came forward, and PFLAG is Parents and Friends of Lesbians and Gays, and they encompass the whole community, even though they didn't change the name. And there are people who are very sensitive and would say, I'm not welcome there, I'm trans, there's no T in that label, PFLAG. So you need to know that those are sensitivities that people have and respect that, and I'll talk about sensitivities a lot. Knowing and respecting people's sensitivities, and sometimes I think I'm so overworked and I'm so exhausted, I think, oh, come on. Yes, again, be sensitive to people's sensitivities because it makes a huge difference to them. They've come to you, they've entrusted their safety with you. They might be coming in the door very wary and very suspicious because they've been hurt or harmed or disrespected. So even when you're exhausted or even when you might not get it, I've had the benefit of being trained by some of the most anxious folks I felt like that I could have met who would run up to me and say, that was really offensive, I can't believe you just said that. Oh, tell me, what did I say? And humble yourself, get your attitude and your ego out of the way and say, please tell me I did not mean to do that, and learn from it and go forward. If you make a mistake, I'm all about like really practical solutions here. If you make a mistake, say sorry and move on. Don't make it about yourself. Don't go on and on. Don't point the person out to a group of people. I can't believe I just said that he was a she. Don't do that to them. Don't point people out. Just say sorry and move on. So those are just some really practical things. I was asked to come in and talk about how you make your office welcoming. I usually do this whole presentation and I talk really fast and I do it in an hour. So to have kind of an hour to talk about that, I said, can I do some Trans 101? So I'm going to do that as well, just because that's something that I think a lot of people sort of know, but might not know more details about and might be interested in. So if that's okay with you, I'm going to talk about the office, but I'm also going to spend a fair amount of time on transgender stuff. Good with everybody? Okay. Let's see. Okay. So I'm going to review ways to make the office friendly. I'm going to talk about the language that's used and it enhances or detracts. I've had whole visits where I've done really, really well, and maybe at the end I got distracted and misgendered someone and saw somebody's face go, oh my God, sorry, I can't, oh, sorry, move on. It happens. And I would like you to become familiar with the basics of trans care, the way people transition, because there's a lot of confusion about that, and the basics of medical and surgical intervention to affirm the client. This is all on the internet. There's tons of good resources. You all have a copy of this, so share it. So what does let's talk about your office. When somebody walks in, what does your office look like? Somebody mentioned this already. What do the posters look like? Who do the people look like? Is everybody, a man and a woman, and they're Caucasian and they're healthy and they're smiling? Is anybody obese? Is anybody dark-skinned? Is anybody, the term is like heteronormative. Does anybody look gay, lesbian, trans? Does anybody look like anything else other than cis, straight, white people? Who staffs your office? Do you have a variety of folks working in your office? Are there maybe people who are LGBTQ who feel comfortable to be out in your office? So just things like that to consider. You're not going to hire someone because they're a gay man, but does somebody feel safe to express that in their work, in your space? And that is from that person. But just as people are hired, is someone thinking about the diversity of your staff? You can have, this is really simple, stickers and signage that are non-heteronormative, multicultural, multi-ethnic. I have a couple examples. And then I kind of already talked about staff. Do you have volunteers? Do you have people who, when somebody walks in, do they kind of look like them? It makes people feel welcome. And if you don't, okay, then, and then just being welcoming to people and not looking askance at them because they might not know the culture of a medical office or they might not feel comfortable. At Adolescent Clinic, we've done all this work that everybody from the secretaries, when you walk in the door, and not that somebody doesn't ever make a mistake, but what's your preferred name? What's your preferred pronoun? We start from there. But we know that there's a whole group of people that don't feel comfortable coming into a traditional clinic. And you've heard the name Stacy Lane yesterday. She's fabulousness, and she's on the north side, and she sees kind of the folks that don't feel, a lot of folks that don't feel comfortable going anywhere else. They feel very safe in her space. I know she has members of the community working there. It's a walk-in clinic. There's a lot of stuff that other clinics really don't manage or can't manage that she just does, and that makes a huge difference, and it makes people feel very welcome there. So this is just a picture. Again, they're all healthy, smiling folks, but a little variety of ethnicity and race and gender. This is just something that we found that we have in the clinic. It's on the internet, just a little rainbow flag. When people walk in and they see that, even if it's a little poster on the side wall, or I have it somewhere else here, the HRC equals sign, I've had people come in and say, I saw that. I know I'm welcome here, thanks. It's just a little something that lets people know when they walk in the door, or other people who maybe are not members of the community, this is an open and respectful space. And then you have to follow that with all your behavior that you work with clients. You want to train all the staff, from the front desk folks, from the registration people, from the folks at central scheduling, which the poor people at central scheduling deal with the whole of UPMC. They've got their script that we gave them on how to try and make appointments for folks and asking appropriate questions in a very respectful way. Ask everyone, don't assume. Ask everyone wherever you feel it's appropriate in your interview, it might be the first thing on our intake form that clients fill out. It's one of the first things. What's your preferred name? Their legal name is on a sticker, and what's your preferred name and what's your preferred pronouns. So for people for whom that does not apply, they say, huh? I say, well, we see everybody, and we see transgender folks here, and we like to be really respectful, and you have to ask everybody. It's done. You've put it out there. And you've put it out there that you're a welcoming and respectful place. You don't know where that goes. You don't know that someone doesn't feel safe that day. You don't know that it's not their sibling, their parent, their friend that then calls the next week, hey, I heard you're an okay place. So putting it out there and letting people know, whether it's for them, they'll hear it. If somebody needs to hear it, they'll see it and they'll hear it. Figure out the way that it works at your organization. It's hard with electronic records, but we have people working on it. We just had a meeting Tuesday. These are challenges in the system, but try and figure it out at your place. Somebody just mentioned, you don't want to have somebody calling someone's legal name over and over, because when Mary looks like John, you don't want to say Mary Smith. What happened? No, I don't think so. Better? Okay, sorry. Maybe we'll just hold it. You don't want someone, and this is, I've had a few clients tell me this, they went to a provider and their legal name got called over and over, even at places that should have known better. And they, nobody wants to stand up. Waiting rooms are small and people are looking around. So when a name gets called, kind of all the heads look up. And you don't want someone being outed in your waiting room. If it's something that you can't manage, or as people are first coming in, call people by their last name. When someone signs in, how should we address you? Do you have a preferred name? And not just if they look like they might be trans. Ask everybody. People use their English name. People use their middle name. How should I address you? What are your pronouns? What would you like to be called? Write it on a Post-it and stick it on their paper, something. But ask people and ask everybody. And use the names and terms that client uses. And one thing I keep saying, just to point out very clearly, I don't say what's your real name, what's your legal name, what's your insurance name, what's your government name, not what's your real name, because your real name is your preferred name and what you call yourself. So just watching things like that, it makes a difference to people. I already talked about not outing people in the waiting room. Sorry, this is why I have to have a PowerPoint. So change your forms if that's needed. After yesterday, I thought, and this is happening at Adolescent Clinic, we have preferred name, but we have kids who have changed their name legally. And so now their preferred name is their legal name. Sometimes their gender marker doesn't get changed on the electronic record. We had a nurse with all good intention try to dig back to try and find someone's preferred name, and she pulled up the original, their birth name. And for this poor kid who was devastated that the nurse, who was kind of new but doing her best, called out the wrong name and called out the old name, thinking this kid was transitioning to female, and in fact he's a trans guy. And so it's a lot of work, and it makes a huge difference to make people feel safe and welcome in your space. It's worth the effort. You'll figure it out with people. One of the parents came up with a little card that says, that they hand over to the registration person, and it says, please read this in its entirety. My legal name is, my preferred name is, please refer to me as. Anybody could come up with something like that. It's just one of the things one of the parents gave us that I pass out sometimes. So watch the age of the client. Confidentiality is paramount to a good working relationship with a teen. So while I'll ask stuff with the parent in the room, because I typically, if someone's under 18, their parents have brought them, I'll ask a lot of questions. I have it easier because they're coming in for gender services and they're marked for that. But when I ask confidential stuff, I'll ask. They've also hopefully filled out a form without their parent watching them, but then we get the parents out of the room and ask the teenager questions. So, you smoking cigarettes, you're using weed, you're drinking alcohol, who are you having sex with, what body parts are you using? that kind of stuff. Are you using condoms? Are you having safer sex? All those kind of things to try and get it out there, but you can't do that with the parent in the room and asking about mental health concerns at the same time without the parent in the room, because sometimes they won't tell you in front of their parent that they're suicidal. Just some signage, a gender-neutral bathroom. So even here in a big hotel, one of the challenges is we've got a couple bathrooms here. We want people to feel comfortable, but we don't necessarily have the authority to mark gender-neutral bathrooms on all the bathrooms that anybody here might be using, but it's something you can do. So why does a one-person stall in a bathroom have to be a man's room or a woman's room? It's a bathroom. So little things like that make a difference. And again, you're showing people that you're open and you're accepting and you're welcoming. So language, be aware that clients may anticipate negative treatment. So people can come in. I've had people come in. I've literally walked in the room and people are shaking. It's like, oh, honey, we're just going to talk. It's okay. Don't really relax. We're just going to talk. They're so nervous. There's so much emotion to coming into that appointment. They've been told that sometimes they're wrong. There's something wrong with them. They have a mental health problem. You're never going to be this. Don't look in your pants. You'll never be. And now they're coming in and this appointment matters so greatly. So know that when people come in, they might be anxious, a little irritable. They've waited. In my case, they wait for me because they kind of overload our schedules. Just know that people might be a little more anxious. I had one person that said, I have to tell you, it took me 2 hours to work up the courage to call for the appointment, and then I got an answering machine. No one called me back. That's huge. They probably didn't call me back because I'm trans. They probably didn't call me back because I'm gay, and they knew it. Know that those things exist. Know that people will be guarded sometimes of their information unless they are made to feel welcome. Don't be, I can't believe you didn't know that I was open. Thank you for telling me. Thank you for sharing such personal information. We find it important to know all about a person. I have no judgment of, I'm going to ask you some really personal stuff about your sex partners and what body parts you use, because I want to know where I need to test you for STDs if that's the case. If somebody is not sexually active, is that okay for you? Is that something that is bothersome for you? Oh, I can't, that's a no-go zone because I'm so anxious about my gender and my body is so dysphoria causing to me. So those things are going on for people. So when you're taking some time and asking and allowing people to tell you, they will tell you all this really personal stuff. Know that people have been discriminated against. They've been told, again, that they're wrong, that their stomach ache, you heard this yesterday, stomach ache is due to being trans or other stuff. So just be open to that and ask. So heteronormative kind of comments. Do you have a boyfriend? Is your father involved in this? Well, maybe there's two mothers. Maybe they don't have a boyfriend. Maybe they have a girlfriend. Is your husband aware? And then the classic thing with kids. Now, honey, I'm sure you don't do that, by well-meaning people. You can't say that because then, well, I'm not going to answer, yes, I smoke weed when you've just said it that way. I'm not going to say I've had 5 sex partners this month. So just ask very openly and very non-judgmentally and practice. And when you can't fall asleep at night, how would I ask that question? Driving down the street, how would I ask that? Watch stuff on the internet, watch some YouTube stuff. Just see how people talk and you'll get some of the language. I can't say I'm always perfect at it. It was so much easier when I could just say, do you have sex with men, women, or both? And now I have to say it differently and ask what body parts do you use. It doesn't kind of roll off your tongue as easily, but it's important. So gender neutral examples. Do you have a romantic or a sexual partner? Are you sexually active? I want to ask you some specific questions so I can gauge your risk of STDs or pregnancy. Just because someone is LGBTQ doesn't mean they don't want to be a parent or they do want to be a parent, that they might have STD concerns or not, that they might be sexually active or not. You want to ask. Somebody mentioned this yesterday. They were so impressed that the doctor would ask this, what do you call your body parts? I have one guy that's so thrilled that I would call his chest his bumps and that his period was Shark Week. He's like, you'll say that? Sure, why not? So I had to put a little note for myself. And then next time he came in, I said, how was Shark Week? Which is true. So, just ask, and then I'll say stuff. And sometimes, this might be more with younger kids, but I work with folks who aren't always as sort of medically literate, I guess I could say. So I say a lot of stuff in doublespeak. So do you have constipation? Do you have trouble pooping? Do you have rectal sex? Do you have sex in your bum? Do you have sex in your butt? Things like that, asking people, they might know and they might sort of know. And so I try to say stuff if I feel like there might be a little challenge there with understanding the words and not be insulting to somebody. How many partners have you had in the last 2 months? How many in the last 6 months? You're just trying to gauge what their risks are. And were those by your consent? Was those things you wanted to do? Were you high? Were you drunk? Were you doing it for a place to stay or for money? Is that a lot of people do survival sex? Just asking. And somebody might say, oh, no, I would never do that. They also need to know that they're safe to say that with you. Somebody mentioned yesterday slut shaming. Like, we don't want that to be going on. We're asking for a reason. It's not, and I'll say, I don't mean it this way. Like, I don't personally care. If you've had 10 partners, I care because I want to know what your risks are, not because I'm going to go talk about you and have a judgment over you. Are you using condoms, dental dams? Sometimes, most times, and I'll say stuff kind of at the further end, so to allow them to say more or less. So, and I was doing this, I'm at the homeless shelter at Family Links, I'm at Adolescent Clinic, I was at the GLCC for a couple years doing a free clinic, I was at Schumann Center for 20 years. So it's not just, I asked everybody. So you get these big guys at Schumann Center, it's a detention center, so these big guys, like, oh, so are you attracted to guys, girls, or both? What are you saying, lady? Oh, that was a big reaction, wasn't it? And then but I ask because I'm trying to be respectful. Just because you're a big guy doesn't mean you're not gay. Just because you're a big guy doesn't mean you don't feel that you're a woman inside. So I ask. And just put it out there and put it out there. And then again, and somebody else, I'll say like, so how many partners in the last 6 months? Oh, I don't know. I'll say 30? Oh, no, 20. Okay. How about condoms? Like giving people the room to oversay it or undersay it, or, well, actually, I don't have sex. I've never had sex. Okay. Do you know about safer sex if you feel that's appropriate in the future or those kind of things? Great, you've put it out there. Another, talking with parents. Is there another parent involved? Not, where's dad today? Maybe kid has 2 moms. Have you ever had sex with, asking, just because someone identifies as gay or lesbian doesn't mean maybe they haven't had sex with someone of the opposite sex. Do you, how often do you, so asking those kind of things. How do you identify in terms of gender? What does that mean? Well, it means how do you feel internally if you're male, female, both, neither? Oh, I'm straight. Well, that's another topic. But just kind of putting that language out for for folks that need to hear it, they will hear you and they'll know that you're safe. Are you attracted to men, women, or both? So I'll say, sometimes just kind of, I try and say it the same way every time, but I don't always. Attracted to men, women, both, neither, cis, trans, just people. How do you decide who you're going to have a relationship with? How do you decide who you're going to have sex with? Do we need to talk about birth control? Do we need to talk about STD prevention? Ask client, if someone confides in you, who are they out to? You don't want to be the person that when the parent comes back in the room, you say, oh, so thanks for sharing with me that you're gay. And they aren't out to their parent yet, or their partner, or whoever. So asking, who are you out to? Are you safe? Is your housing secure? Do you have any worries? Are you at threat of being put out of your home? Are you at threat of physical violence? And avoid using the terms heterosexual, homosexual, and transsexual. Those are old medical terms that really we don't use anymore. And sometimes you'll see them pop up in old paperwork. Be prepared if somebody doesn't use safer sex techniques. So say if somebody says, like, no, I never use condoms, and I have a lot of partners, and that's just what I do. Okay, do you know about PrEP? Do you need that? What should we talk about? What are the other options for you? I'm concerned about your safety. I'm concerned about your health. Have brochures that welcome people. You can have stuff from other clinics, or if you're like me, you jump up out of your chair and run to your desk and pull stuff off and run back into the room. I like a crazy person all day running back and forth. A lot of people load stuff into their computer system. I'm going to show you at the end, or I'm going to have somebody jazzy with the computer show you at the end. We have a bunch of stuff loaded onto our website. And again, I kind of said this already, but remember that just because somebody's LGBTQ doesn't mean they don't want the same thing that anybody else wants. Everybody wants the same stuff. They want healthy bodies, healthy lives. They may or may not want children. They probably want a community of friends and family, whether it's their chosen family or their birth family around them. You know, kind of everybody wants all those things, so don't be afraid to ask people. You know, kind of just general people stuff. Everybody's people. Another little thing you can put in your office, just a rainbow flag. It's surprising what it does for folks when they walk in the door and they see it. This is the Human Rights Campaign sticker. We have one on, my husband and I have one in our cars. And we were at a bed and breakfast, I don't know where we were, in Maine or something. And a couple came in and a guy said, "Is that your car?" And I said, "Yeah." And he said, "Okay, I saw that sticker." You know, and he and his partner were comfortable to be themselves around us. Just a little thing. I was like, "Oh, well, that was surprising." But you know, just something that we support and put it out there, and it was helpful. Have a list of LGBTQ resources in your area. So again, if we have this big map, it'll be great. But looking into seeing what's in your area, because folks may not know, or they may not know how to look it up. Maybe some folks that are a little bit older who aren't so internet savvy. Thinking about, for folks that work with adults, older adults, I think about nursing homes. Does anybody ask, like, who were your romantic partners in your life? Not by name, but you know, if somebody's in their 80s and they're in the nursing home and their partner, and it's a cis female or trans female, and their partner was a woman, like, does anybody know that? Does that woman ever get to say, "Oh, I miss my wife so much, I miss my partner so much"? Or does she have to kind of closet herself yet again? So just kind of keeping open the conversation all the time. In Pittsburgh, we have the Gay and Lesbian Community Center, which is downtown. PERSAD is a big counseling center. Delta Foundation is one of the LGBTQ groups in town, an advocacy center. Garden of Peace, Project Silk. There's gay straight alliances, gender and sexuality alliances, and libraries and schools. I've had a bunch of kids come in over the months and years and say, like, "Oh, I started a GSA in my school." Like, how cool is that? You know, anybody can start, one person, find one other person, and you can start the group. And it might be a group of 3. I have a group of kids from Johnstown. Like, you guys should have your own support group. Well, we do. That's why we all come to you. You should all come on the same day and save gas. So, you know, but, you know, because I'll get these kids that can't get into town because they don't have cars, and they're underemployed, and they have insurance, which is how they come to Children's, but, and we have ways to work with that for folks that don't. But, you know, just encouraging people, do your own thing. We have this huge PFLAG potluck that happens once a month at PERSAD, and it's about 40 families that get together on the 4th Thursday of the month at 6:30 at night. It's open to anybody, so who are parents, siblings, aunts, uncles, guardians of trans folk, and then the kids all kind of hang out in the other room, and the kids go from 3 and 4 years old up to 26, 27. Some of those want to be in the adult room. But it's just folks getting together, and that started with 2 or 3 parents in the endocrine waiting room waiting for Dr. Witchell, however many years ago, 7, 8 years ago. Like, let's go out for our dinner. Let's go out for coffee. Let's talk about this. I need someone else to talk to about my kid. And that turned into this huge support group that we have in town. Okay, so that was just kind of my general office stuff. Is it okay if I kind of concentrate on some transgender stuff with everybody? I think I have another, oh, come on, phone. I have another 20 minutes or so. So this is, so people know some other stuff. This one just came to my attention, and sorry, it's a little bit cut off there, but it's like a gender world cartoon, and it's just kind of cute. There's Ladyland and Manlandia, and people can travel back and forth, and there's the gender diverse island. There's agender folks can be out in the little satellite out there. So it's just a funny little cartoon, but these kind of things kind of take some stress off when somebody says, "I don't get it, I don't know what this is about, I don't understand what my family member, my loved one, my partner is doing." There's a whole bunch of script on that, but that's on the obviously in the PowerPoint, and you can read it. It's just something cute that just came up recently to me. So what's the issue? I think we've kind of covered this a few times, but it's a very gendered society. We tend to talk about people, we identify white, black, Latino, Asian, male, female. We just kind of sort everybody out all the time. Even in pregnancy, we want to, before somebody delivers, are you having a boy or a girl? A lot of us do it. It's just part of how we are. A baby is born and somebody looks at the genitals and says it's a boy or it's a girl. So that's where the term comes, gendered at birth as. So you don't say this is all language, somebody was born a boy and now they think they're a girl. It's completely disrespectful of what somebody's going through or what they're going through, what their thoughts are, what their feelings are about their own body that may not match their identity. So someone is gendered at birth as, and then it's how they identify. So for the most part, for most people, that assigned gender at birth matches who that person is as they grow from childhood to teenage years to adulthood, and that's, as you know, called cisgender, CIS. And if you're not cisgender, and if it doesn't flow for you, then you're trans, and trans can mean kind of anything else. And by the way, if I say anything wrong, please anybody correct me, because I want to say everything right. So for others, when it doesn't match, like why is that an issue? It's an issue for a lot of reasons, because people are disrespected, they're treated differently, they're sometimes murdered, they don't get ideal medical care, there's lots of stuff going on. So let me go back to my PowerPoint. Transgender is an umbrella term. As I said, kind of if you're not cis, you're trans, and it encompasses a wide group of people. Not everybody that's a trans man is the same, and not everybody that's a trans woman is the same. It's a shorthand. It used to be, you'll still see trans with a little asterisk. That was sort of done for a while and doesn't seem to be done anymore. You talk about people, I like to say, in the direction that they're going. So where somebody said earlier it used to be FTM, MTF, that can be insulting or anxiety provoking in people who say, I'm MTF, male to female. You're throwing it in my face that I was gendered male at birth. And that might feel like, well, it's just shorthand, but it can offend somebody. So the proper terms would be a transgender man, transmasculine, man of transgender experience. Ask someone how they like to be identified. And same vice versa for a trans woman, trans female, kind of the same thing, gender queer, gender fluid. So gender queer is feeling both male and female at the same time. Gender fluid is someone who kind of goes back and forth. And this isn't just like today I wear pants, tomorrow I wear a skirt, but I'm a female. It's really identifying in your core that you are male or female and feeling the desire to put that out to the world because the world is so gendered. And for some folks, that's what's right for them. Some people, feel it as far as having maybe a different name. One of the Arquette family, they're an acting family in the country, one of the Arquettes died last year. And the family, some people were offended by this, but I thought it was, from my experience, like kind of lovely. The sibling said, when our sibling came down the steps, we knew by the way that they were dressed if they were their masculine self or their feminine self, and we just flowed with it. We love our sibling. So it's not that strong a need for everybody, but for some people, and just asking people, again, how do you identify, and flowing with it, and what does that mean to them? So another cute cartoon, gender is a spectrum. So from the little pink woman to the guy at the end, and from Barbie to G.I. Joe. So somebody looked at this and said, you should have a G.I. Joe with like a dress on and a beard. So, but and this is in no particular order, but sort of this. So being a binary person is male or female, one or the other, and thinking of gender as a whole spectrum. And then I like to use the term gender expansive instead of gender nonconforming, because I just think it's a more positive term. And again, these aren't in any order: gender fluid, gender queer, and kind of all the way to female. I mentioned already cisgender versus transgender. You have to ask people where they're at. And sometimes those things change over time, and that's okay, and that's important to let people and parents know. Sometimes people evolve over time and may find that they identify differently a few years later. I have some kids that come in and maybe they've fought really hard to get their parent to bring them in and they're trans boy, and then one day they come out in a dress and makeup and the parent goes, what is this? Have you been lying to me? No, they're just expressing themselves in a different way, and maybe that day they want to kind of go back to their feminine self. It's not, there's nothing wrong. It's not that they're lying. They're not playing a trick. It's just part of it. Some people kind of come and go within and out of it, and to let people know that that's okay. Okay, so I talked about that. So, and this is really, this isn't something that people do for fun. They're not doing it for attention. They're not doing it to get back at their parents for getting divorced or because they got their allowance taken away. This is somebody's core identity that they feel the need to express to the world. And folks can face, not everybody has a lot of support. So folks can, face disappointment. They can be misunderstood. People get mad at them. They think they've lied to them. They might lose their family, friends, community, job, housing, partners, children. People are just trying to be who they are. And when somebody perseveres through all of that, potentially all of that loss, and I'll say to parents again, because that's who I work with, this is telling me that your child's need to show this part of themselves is really strong. And this is not something that they're doing to get away with it. They're not doing it to you. These are things that have been said to me. She's just doing it to get back at me. She's just doing this because she's mad. No, she's not. No, he's not. As the case may be. So just really knowing that this is somebody's deep need to show themselves. This is this is not the current hip version, but I like the genderbread person because I just think it's a cute cartoon. But it's just a little person, and I like to use this to explain to people. I talk about this all the time. My friends will tell you. I talk about this all the time. I'll be out kayaking. Hey, I do transgender care. Oh, I have a niece who thinks she's gay. Oh, that didn't quite work. And they'll go like, well, I don't know what that means. So I'll stand and go, or I'll put my paddle down and say, gender identity, it's who you are in the spectrum of male to female. Think of gender as a spectrum. Not everybody's like 100% one thing or another. So your gender identity is in your brain. It's regardless of your body. It's regardless of whether you have penis or vagina. Who are you in regards to gender? Your attraction, is, Betty Hill would say, like, who makes you go, whoo, when they walk by? So you're attracted to male people, male-bodied, that's not the right way to say it. Cis, trans, people with penises, people with vaginas, who are you attracted to? Your sex is what people typically call your genitals, and some people find it offensive to say, like, biological sex. So when sometimes medical people will say, well, they're biologically a male, but transitioning to female, that can feel very insulting to people, so you want to be careful. And your expression is, how do you put that out there to the world? Do you, have long flowing hair and lots of makeup and high heels? Or do you, dress in jeans and tennis shoes and a t-shirt? Do you wear cutoffs? Do you, how do you put it out there? Do you wear a beard? Do you, whatever. How do you put yourself out there? And these things are often felt to be a masculine style or a feminine style. The gender unicorn is the more current version of this, and the trans student group said a cisgender man can't say what it's like to be trans, and so they very clearly we stole all this stuff and we put a unicorn in there. So that's what some folks find, some folks like the unicorn better. And it's just kind of the same stuff, and if you look at this, we have these in our clinic rooms. We just have one posted in each room, and you walk in and people are looking at it, and I'll say, like, oh, here's your copy of the genderbread person. I saw that. I was looking at that outside. What's that about? So just kind of nice stuff to help people understand maybe what their loved one is going through, is experiencing, wants them to know about. So clients can present as very young children, 2 and 3 years old. I get phone calls from parents who say, I don't know what's, these days, it's a little more, I think I have a transgender kid. I think this is what's happening. I've watched stuff on YouTube. I've done some research on the internet. But kids present sometimes at 2 or 3 years old. They're little kids. Oh, you're a good girl. Oh, you're a pretty girl. You're a big boy. And then they'll go, no, I'm not. I'm a girl. When am I going to get my boy parts? Or start crying, and the parents will find, I don't want to wear those shoes. I don't want to wear that dress. And so hopefully, if, as people are asking, and if we start asking, and if we ask everybody, and when the kids come in for their pediatrics appointments, anything going on? Anything going on with gender? Anything going on with behavior? Are you a boy or a girl? Well, I'm a girl. Okay. Having those conversations early and often so that it's not a problem, just like you would ask what their nutrition is. Some people find this of themselves or find it out about themselves or figure it out about themselves as they start puberty. Bodies are pretty androgynous. You can kind of, move through life in some families and some neighborhoods pretty unassuming until you start to pop breasts or facial hair. So that's a lot of time that people start to self-identify. Young adulthood, 15, 16, I get a lot of kids coming in around that age. I get a lot of kids coming in at 18. They can't tell me I can't do it anymore. My parents wouldn't bring me. I couldn't tell them. I still haven't told them. I'm at CMU. I'm 18. I'm 19. I can do this for myself now. I need to come in and talk about this. I've known for years. I'm still sorting it out. I'm still figuring it out, but I think it's something. Great, thanks for coming in. Let's talk about it. Let's get you to some, I'm more of a medical person, like let's get you to somebody to talk about this with. There are folks who are adults. People go into Metro, which is the main adult clinic, at 60, 70 years old to transition. Maybe their parents have passed. Maybe they've woke up one day. There's a woman in town who's a very big advocate who transitioned at 60. She woke up one day and said, I can't do this anymore. I need my transition. And so she started going, and I see her at meetings. She comes to our meetings. A lot of people in the community know her here. But she is, and when we had our first meeting, she looked around and said, where were all of you when I was 20? There weren't services then. Nobody treated anybody under 18 till about 10 years ago. So, that was the cutoff age. So clients may come in specifically for gender concerns, but everybody here is working with lots of folks in lots of ways. If you're asking, people will know you're safe and they may feel comfortable to tell you. It could be brought up at another visit. It could be brought up with mental health issues. I have a lot of folks who have issues of depression, anxiety. They've isolated. We have a few folks with really serious eating disorders. They're trying to control in their own way what's happening with their body to a point where they're 85 pounds and they're 5'6", and they're at real risk of their life. Before someone asks, and and if somebody would have asked the question, maybe they would have felt safe to tell. School grades, running away, those kind of things, ask. They might have little insight and no language. I have some kids that come in and I try to just sort of use a little bit of the lingo to see where they're at, and then I turn to the parents and interpret, and I'll say, do you know what that means? Do you know what that means? And the kids will either light up, like, oh, you know what you're talking about, or say, I have no idea what you just said. Okay, then I just kind of change my flow. And parents, we have a lot of support for parents and loved ones as well. Again, always good to try and get the kid without the parent in the room at some point, just to ask those more private questions. There's things that you have to talk to parents about if they're at risk of their own safety, if they're being harmed by somebody else, and you have to warn folks. I ask everyone about abuse, and I'm going to ask you about abuse. And if you tell me something that hasn't been reported, I have to report it. I'm a mandated reporter. Has there been any time that someone has given you physical abuse, that you've had times of physical abuse or sexual abuse? Is anyone harming you now? Or are you in a safe relationship? You kind of learn, again, think about it while you're driving down the street or walking your dog. Think about ways that you can say that. I have to get rolling here. Ask everybody how they identify. Only disclose to parents with the person's permission or to other people. I just want to throw this in before I forget. One of the big things about doing this work is you might be referring someone to someone else. I send somebody for a chest x-ray or whatever, to the GI doctor. I call the office first. Hi, I have a transgender client coming to see you. Is everyone going to be respectful? Do you need me to call and talk to you ahead of time about this? I want my client to feel safe when they come in. Oh, no, we get it, miss. Or, no, please tell me, and this is the preferred name, this is the legal name, please make sure you don't out them in the lobby. Thanks, I didn't realize all that, but we're totally on board. So that's just something that sometimes is an extra step. So terms to avoid and preferred terms. A person is not a transgender. They are a transgender person. They are not transgendered. They are transgender. They are not biologically male or female. They are assigned male or female at birth. Tranny is really bad. Some people think it's a cute nickname. It's usually something that's said as you're getting beat up. Somebody's trans. Again, don't say real name. It's their legal name, their insurance name. Some people call it their dead name. That tells you what they feel about the name they were given at birth and what that means about their identity. You'll never be a girl, you'll never be a boy, look in your pants, you're only a girl. Those are things people hear, and they might hear it from their family. They might hear it from their brothers or sisters when no one's listening. They might hear it from the kid in the hall that pokes every time they walk by them. And be sensitive, again, to folks' sensitivity. Sometimes you think, oh, I have this one person in mind who I would say something, and I would say to other people I was presenting with, I'm sorry, was that offensive? And they'd say, no, a lot of people say that term. But to that person, it was horribly offensive. And they were very anxious, and they've had a very hard time in life and lots of abuse. And so they live very protectively in their world, and they taught me a huge amount. What to expect at a visit. It's a lot of talking. As I say, when people come in and they're shaking, or you walk in and the kid's crying or the parent's crying, we're just going to talk. I bring this up because one parent came in and said, my pediatrician, and I don't know that they said this, my pediatrician said you were going to do blood work to tell me why my kid says this about themselves, why my girl thinks she's a boy. Nope, doesn't work that way. I'm going to do blood work if we get to that point, but that's for baseline for hormones or cross-sex hormones or blockers, but not to tell you why this is happening. So it's a lot of talking, asking them who they are, what they're about, what do they want. They might have come in for information. They might come in because they're ready to start hormones. They might come in for other reasons. They might need help at school or at home, so I ask. We do a regular history and physical, and a HEDS assessment is home, education, activity, drug and alcohol, sexual activity, kind of educating the kid, or the client, their support people. There's no labs to discern the cause of the disorder, but we do labs when we're doing any medical intervention. There's no reparative therapy. There's no, this is wrong, and I'm going to tell you why you're wrong about yourself. As appropriate, and I don't make this mandatory. A lot of people do. And there's certainly a lot more feeling that it needs to be kind of more mandatory with younger kids for therapy. I think transitioning can be a rough road for some people, and I like them to have another level of support. And I'll just literally say, like, we are the people standing in support around you. This is your team. Hopefully your parents and your family are on board. But I would also like you to have somebody, and sometimes it's gender coaching, so our social workers do that. What does this mean? What is it? How are you going to deal with dating? How are you going to deal with the school? What are you going to do at Thanksgiving when you walk in and you haven't seen your family in a year? Just things like that to make sure that people are prepared for reactions they might get, not because anything's wrong with them, of course, but just how do we help people think these things through? Because sometimes they're faced with stuff and they don't know how to deal with it, and then they think, oh my God, did I make the right decision? Nobody wants regret. Clients don't want regret. Medical people, mental health people, parents, nobody wants regret. We all want people to make the right decisions. And I would say I've had one person out of 200 that came in and said, actually, that's not right, and I've stopped my T, and I'm actually not trans. And that was a surprise to me. This is a kid who was suicidal, who had lots of other stuff, who has a whole host of things going on, but said, I can't wait till I'm 18 because then I can sign my papers, and why are you making me wait? Because I have to wait till they're 18 to sign their own papers, and their parents weren't in town. So just nobody wants any regret. And we just, like, if it's that important, let's talk about it. Let's make sure that you never look back, that your parents never look back and say, I wonder if. So how clients transition, I'm going to go fast because we're almost out of time. Things are fully reversible are things that you can totally reverse. So clothing, shoes, prosthetics, hairstyle, etc. Blockers are expensive. Sometimes now they're covered by insurance, but they are reversible. It allows time, the blockers for a younger kid, and we use them in older people too, but ideally you would use them at the start of puberty, and they give people time to catch their breath. Maybe this is when the kid has first come out. It gives time to block pubertal changes that wouldn't be right for that person and their identity, and it just gives people some breathing room. They are starting to be covered. Up until about January, it was $3,500 for an Nexplanon or for a Vantis rod, or $26,000 depending on which version, or $1,200 every 3 months for the Lupron shots. So those are blockers. I'll go into that in a minute if we have a minute. Partially reversible are some of the effects of cross-sex hormones, and irreversible are some of the effects of cross-sex hormones like hair growth, breast growth, possibly infertility, it's not an absolute, and surgeries. Just wanted to show you a couple things. These are binders, so they're like a very tight sports bra, but it compresses the chest tissue. And I say, when I talk to trans guys, I talk about their chest, not their breasts. If I need to do a chest exam, I ask them to do a chest, would they like me to do a chest exam? It's not mandatory. For a lot of folks, that is very anxiety provoking. Any genital exam for some folks is absolutely off limits. Okay, I would like to do it at 21. I really need to do a pap smear. I really, really need to do that. It might be when you're 23 or 24 because that's when you can handle it. Bring in your partner, bring in a friend. Let's try and get you through it, but it's really important. And if they say no, I say, okay. You know, but we're looking for cancer. That's something that's really important, and we're really sensitive, and we can do it really quickly. But that can throw someone into a total anxiety attack. Packers are artificial male genitalia, or artificial penis and scrotum, I should say. There are stand-to-pees, so that you can wear them with a strap. You can attach them to your body with medical adhesive. You shave off your pubic hair and attach them to your body. Some come with pubic hair. You can use them for sex, depending on the kind that you get. It allows someone to both fill out clothing that's made for penis genitalia for that shape, but also somebody can walk into a bathroom and pee in the urinal in the trough like everybody else. Blockers, you can read this over. They're expensive, but they buy time. They give people time for counseling. They are reversible. We check hormone levels before and then every couple months. Cross-sex hormones, basically, feminizing hormone is estrogen. It can be pill, patch, or injectable. Masculinizing is testosterone. Also with feminizing, we use spironolactone typically to block testosterone. It helps to get effects that somebody wants for their body. And I have kind of the changes that happen. We do physical exam for baseline and labs, and we do labs regularly just to make sure people's liver, kidneys, we talk about blood clots, that kind of stuff. Feminizing surgeries are affirming someone's gender identity. Not everybody decides that that is right for them, but for some folks, they want that. So they're also known as gender reassignment and gender reconstruction, or gender affirming is, again, a more positive term. Vaginoplasty, labiaplasty, vulvoplasty, breast augmentation. Orchiectomy is removing testicles. So not everybody wants their penis removed, but they might want their testicles removed, and that helps them with their body feel more in sync. Facial feminization, tracheal shave, there's huge lists of surgeries. Most things are covered now. Top surgery typically is covered, and genital confirmation surgery is covered. Usually you have to have mental health letters, 2 for bottom surgery, 1 for top surgery. So that's one of my ways to kind of encourage folks to get in to talk to somebody. If you're thinking about surgery, you're probably going to need a letter. So start a relationship. And even if everything's great in your life, terrific. Then you just need to be in touch with that person for your surgical letter because you don't have things going on. If you have some anxiety or depression, talk about it. Let's deal with your stuff. So masculinizing surgeries, bilateral mastectomy. So sometimes a little bit of chest tissue is left to form, so somebody's not completely flat. So there's about 6 people in Pittsburgh that do breast augmentation, breast surgeries. They don't always list themselves as top surgeons, but there's a condition of bodies with penises who have breast tissue called gynecomastia. So there are cis guys walking around that have this breast tissue that grows. A lot of times it goes away later in puberty. But some people go in for that surgery because they've had this growth and they don't want it. It doesn't fit the societal norms of a male chest. So there are people that do that. They may not call it top surgery, but ask a surgeon, have you done have you formed male chests? Because then you might find there's a lot more people around that have done that. We don't have anybody in town right now doing any kind of genital surgery. We're grooming someone and hoping that he sticks around. So be open. I'm out of time. Be open, ask. Be supportive. Make up your own groups, your family groups. Introduce, I've said to people, I've had kids that say, I have no friends. Can I have somebody call you? And then I call my clients and say, or somebody at one of the centers, poor Lindsay Sickler's gotten my phone call a million times. That person said, hey, can you call my client? They don't have any friends. Please, can you give them some support? Absolutely. So, I play matchmaker for friends, but people sometimes are so isolated. We started a little transgender support group for 14 to 18-year-olds because of it. I did an 18 to 25-year-old group, but it kind of pooped out after a while, so I stopped. But, just to find out what people need and offer to facilitate that. Tell everybody, whoever you are is fine. You're fabulous. You're wonderful. We're going to help you. I want to be able to help you on this journey. It's not my transitioning them. I am affirming their gender identity. Home needs to be a safe zone. School needs to be a safe zone. We go out and talk to schools. We get tons of requests. What are your policies? PERSAD has a whole group that goes out and does that. Get support, have parents or family or friends get support. And I don't like to throw this out here, but sometimes you have to. It's better to have a live transgender family member, loved one, child than a dead cis person. People kill themselves over this when they're not accepted and not supported. People carry, as we heard earlier, years of pain and abuse and disrespect. Not everybody, and some people look like they've got the world on their shoulder and they're great, but they might have very strong trouble inside. So asking people, supporting them, thank you for telling me, thank you for coming in, how can I assist you to affirm your identity? So this is just kind of the same stuff, how to prevent abuse by being supportive, gender coaching, this is all in the PowerPoint as you can see, and local resources and national, everything's online. There's great medical guidelines. We have a symposium happening that we're hosting for the second year on September 29th. It's a Friday. It's at PERSAD Center. It's about $40. You'll get CEUs. So there's a mental health social work component and a medical component. And so if people want to know about that, they can send me an email. All the stuff I pass out, we have accumulated a fair bit of resources. And what I was going to have somebody do is do a groovy thing like they did before with the internet. But if you go into Children's Hospital of Pittsburgh, so chp.edu, adolescent medicine, gender services, and resources, a whole page pops up with really great resources. I just brought a couple of the HRC, How to Raise a Healthy Transgender Child, because they're on the website. I have a couple little booklets. I have just cards, like postcards for Adolescent Clinic. Call us if we can help you in some way. It might take me a week to get back to you, but I'll call you back. Or families can call and say, I live outside the area, or I'm 30 years old, but I don't know where to go. We do a lot of that kind of stuff. And as I said, we're really connected with anybody we can find in the community. This Saturday at PERSAD at 9 o'clock, we have a big community meeting of providers of all stripes of transgender care in the community. People are welcome to come if they want to be a part of that, or just let me know if you can't come but you'd like to know about it. Clinical resources, that's it. So that's it.
Thank you, Joanne.
I don't know if people have questions.